Washingtonians who are doing so much great work in this effort against the COVID-19 virus. I spoke to the Undersecretary of the U.S. Department of Health and Human Services yesterday, who is praising our efforts in improving our testing capability. Dr. Birx, who has repeatedly recognized our efforts in bending the curve down because of our social distancing endeavors. We continue to see Washingtonians all over the state really putting their shoulder to the wheel and honoring this stay home, stay healthy order. There's just a lot of good things being done by Washingtonians, and it is having a beneficial impact in our state. And we do want to, as soon as we can, transition. And I want to talk about that transition that we need to get to when we can. And that is a transition from the social distancing strategy that we now are engaged in to an effort involving individualized, smart, targeted efforts to diagnose and recognize and protect and isolate individuals who have this disease and might transmit this disease. This would be a major transition from what you might think of as our sort of dull-bladed effort where everyone has to be involved in social distancing to a much more targeted position where we can wrap around protective bubble, if you will, around those that may end up being infected in the future. And that is a transition to be made when two things exist, and they have to exist together. First, our social distancing has to be successful enough that we drive down the number of infected people where we can be confident that we're not going to have the curve start to rebound and go up again because of the number of people who would then be infected. So our social distancing effort has to be successful to a given level to reduce the number of people that actually are actively infected in the state of Washington. That then sets the stage for the second stage of this effort, which is the individualized effort, where we test people rapidly, where we isolate them rapidly, where we treat them rapidly. And you might think of this as, to get to that second stage, we need to build the equivalent of a fire brigade. You know, when your house is on fire, you call the fire department, and they come very, very rapidly. We need the same type of response from a COVID fire brigade, if you think of it in those terms, where a person with symptoms can call, get tested immediately, be isolated immediately, and we can contact trace, go to all the people that they've contacted who potentially could have had the virus transmitted to them. And that takes a lot of legwork and potentially some new technology where we recognize rights of privacy and the like. The point is, as we're reaching this point of transition, we have to have both success of our social distancing we now are involved in to drive the numbers down, and this new sort of fire brigade approach to test people very rapidly and isolate them very rapidly. And both those things have to exist before we can push the go button for this true transition. So I wanted to share with you some of the information we have, the data that is helping us figure out when that transition can take place. As you know, we've been making decisions based on science and data in our state, and it has served us very well. We are a very technologically oriented state. I think that's one of the reasons we've had considerable success bending the curve down now, because our people in Washington accept data and science and make decisions based on logic and data and science. We want to continue that pattern. So I wanted to show you some graphs of some of the modeling that we've seen that could look at our historical rates of infection and what we might see in the future. This is a graph from the Institute of Health Metrics and Evaluation at the University of Washington. And this basically shows, starting in March, moving over to August in the right. And this shows the deaths per day that we have experienced in the state of Washington. You'll see that the numbers, unfortunately, of our tragedies have gone up. And of course, they vary from day to day, up to about, this chart goes to April 8th. So we see what we've already experienced on the left of these graphs. And we are now about in this range here on the 15th of April. And what this chart shows is a hopeful reduction of the rate of transmission and fatalities going down in this dotted line. That is a potential curve if everything goes right. If our social distancing continues, if we continue our efforts, there is a possibility that this curve could continue to go down according to this particular modeling agency, which the world has been watching very carefully. So we would certainly hope that would be the case. I'd like to show you a second graph from the same institute that builds on the first model. This is essentially the first model, but it demonstrates what the modelers have suggested will happen if we in fact abandon our social distancing strategies. So you see on the left the history of the deaths per day and the potential curve going down if we continue our social distancing. But if we stopped our social distancing on April 10th, which is at this point, that curve would start to go up again, and that means additional deaths in the state of Washington. If we stopped our social distancing on April 22nd, you get this preventable death in the dark blue curve. In either case, we have potential increased death in the state of Washington. And what this demonstrates is that we have to remain committed for some period of time to this social distancing strategy. Now, this is somewhat of a blunt instrument, but it is effective because it is, we believe, bending the curve relative to what other states have experienced. Heart goes out to the people of New York who've seen hundreds of people lose their lives a day, and Louisiana and Detroit where they've had much more difficulty slowing down this infection. So it can be effective, it is effective, but it needs to continue if we are going to drive the numbers down to a region where it might be safe to take some of these measures off. Now, I'll show you another graph from a different modeling agency, or excuse me, it's the same agency. This shows the curve of what's called R naught. Basically, it's an estimate of how many people are infected if one person has the disease. And this shows the estimates of the Institute for Snohomish, King, and Pierce County of the three lines. Starting early in the transmission, the curve starts on February 28th and goes down to March 23rd. You'll see that these start at a number of about 3. And what that means is for every person that's infected, when this infection pandemic started, every person infected in those 3 counties basically would infect 3 more people. Very, very dangerous. And that's why we were having such spikes in the numbers of fatalities. Over time, because of some of the work we've been doing together as a community, that number has gone down. So now it is in the region of 1. This is a line that shows 1, meaning for every infected person, they infect only 1 person instead of 3. So you can see in those 3 counties, we've made some real progress on the rate of infection. That's good news. These curves show that what we're doing works, and it shows that we can be in control of our own destiny if, in fact, we remain committed to it. But I'd like to show you a fourth graph now. And I'm going to take just a moment. This is a little complicated, but I think it's an important one to look at. This is from a different agency, the Institute for Disease Modeling, also here in Seattle. This basically takes some historical data and then looks at what the projected number of cases and the acceleration will be and could be depending on what we do on social distancing. And you'll see these dots here basically are data points, with this green curve being the historical curve up to about April 2nd. This line here represents April 2nd. You'll see that the numbers were going up, and the good news is the rate of increase started to level off here. was not as steep, started to level off. Our social distancing has reduced the rate of infection. And this starts to level off as to the fatalities per day. There's two concerns about this graph that we need to be aware of. Number one, this model suggests that this rate is not going down at the moment. It's plateaued, it's level. And that's not as good as we need, because it means we would continue to experience the infections and fatalities we are having today. We lost 30 Washingtonians the day before yesterday, I believe 21 yesterday. Each one of these is a tragedy in a family. It's unacceptable to us. So this model suggests that we need to do more to be able to bend this curve so that it goes down and we reduce the number of fatalities. And that, for that reason, we're not out of the woods yet. Now, this graph also has this disturbing information. They also graphed what would happen if we took off our social distancing right now. And that's represented by this line here, that if we took off our social distancing a week or so ago, this number would start to go up. Our fatalities would go up rather steeply and continue going up until some other intervention occurred. The combination of these models, and of course, predicting the future is tough, they both show several things. Number one, we have had some success with our social distancing. The efforts of people that are so difficult are having a positive impact. Number two, we're not at a level where we can take off social distancing, nor are we extremely close to a level where we can take off social distancing. And number three, if we do take off social distancing, we are going to see a rebounding of this virus and more fatalities even than we are experiencing today. So the combination of these things show that we ought to be confident in our efforts. We ought to be able to realize we can control our own destiny, that we are not simply passive victims of this virus. There are things we can do to fight back successfully against it, but that we have a lot more work to do until we can get to this transition point. So we are working towards that transition point. We're working towards it every day. We are expanding our testing and our capacity to help people to realize if they have the disease. We are protecting our most vulnerable people. Yesterday I issued what might be the first rule in the United States to protect people over the age of 65 at work. We are making sure that our hospitals have enough surge capacity to deal with this virus if in fact it does grow rapidly, and we're maintaining a good cushion in our hospital capacity. We are continuing our research. The Gates Foundation and others are doing some tremendous research right now, cutting-edge research, even clinical trials on some medical processes. We are thinking about the way to increase our safety in our businesses and our schools as we go through this transition. So where we are today is we're not at that transition point. I wish I could tell you when that transition point will be, but I know this. We want it to come as fast as possible. We know the order is in place at least through May 4th, and we know that the more work we do today, the faster that transition point is going to come tomorrow in the days to come, and that's why I'm pleased that so many people are honoring this order to stay home and stay healthy. I want to mention a couple other things that I'm hopeful that people can think about. We've unfortunately, because we've had so much job loss in our state, we've had an increasing number of people who do not have health insurance. And I want those folks to know that we care about you in this situation. We're glad that we have health care reform in this state, and we hope that you'll look at using that health care reform. If you are without health insurance or you're worried about your health insurance, you can go to wahealthplanfinder.org. That's W-A, healthplanfinder.org, and check out your options to get health insurance through these measures. We hope that this will help you get through these troubled times. I want to close on a couple notes. Number one, I'm glad that our state is still working together I'm glad that we're using our constitutional authority to make these tough but important decisions. I'm glad that the President has recognized that these are decisions for us to make in the state of Washington, not in Washington, D.C. I heard the other day that he said that he was going to authorize the governors to take certain steps. Well, we actually have authorization. That comes from the U.S. Constitution and our Constitution, and we will be fully protective of that. So we're having some good working relationships with federal agencies. We're very appreciative of the Public Health Service. They now have doctors helping us in strike teams to go in and help our long-term care facilities maintain the best infection control possible. They're helping us continue in our effort to get test kits. So we're getting some good work with the federal government, and we trust that's going to continue. I'll just close on this note. I know people are experiencing the stress and anxiety that we all feel to some degree, and I know we've all been inspired by acts of kindness and compassion and empathy when neighbors help neighbors and business people keep paying their employees, and untold acts of kindness. But I want to point out it's a good time not only to give help, but to be willing to ask for help too. And maybe you're a person of some age that would rather not go to the grocery store right now. Don't be shy about asking the teenager next door to do your shopping for you. They got some extra time on their hands right now. And we hope everybody is willing to not only offer help, but to ask for it as appropriate. With that, I'm happy to stand for questions.
Normal will mean that general physical distancing and masks and not shaking hands and that sort of thing could continue for many, many months, even after we hit a transition point and restrictions start to lift. You agree with that assessment? And another question is that he also suggested an incremental approach of reopening various things may need to occur. So I want to know what you think that might look like, and if you could give us any examples of what parts of the economy may open first and when.
Well, I think that this transition will not be a light switch on and off. It will be a dial, and we will dial it up and down as the data suggests and as our community responds. And it will be a phased approach. The phasing will be probably the reverse of what it was going into the effort. We started by prohibiting large gatherings. We then closed on-site education in our schools. We then had a stay-home order in our individual lives. We then closed non-essential businesses. And as we come out of this, we presume that that will be in inverse order as we come out of this, as we open up some of our economy and our personal lives. And that makes sense because we'll be bringing back the things that are most essential to our economic and physical and financial health, and then working out to the periphery of things that might be maybe some of the most joyful things in life, but maybe not the most necessary to maintain our household income and otherwise. So it'll be a phased approach. The pace of that will depend largely on the data of how this data responds to what we're doing. I was talking to a leader at Starbucks the other day, and if I may quote, I hope they've released this, that basically they have an approach of monitor and adapt. And I think that's a good way to look at this. We will monitor how each part of this dial is reflected in the data, and we will adapt depending on what we see as we move forward. As far as what John said, who's done a fantastic job, he and Kathy Lofi have just been invaluable state assets in this. I think they've made some really good calls and advice to me, and I just can't overstate how valuable they are to the state effort right now. And I think they're right that we will find some cultural and other differences in our personal habits for months going forward in this regard. And I think a lot of those things we won't find particularly intrusive. People might be relieved from having to shake hands with politicians here for some period of time, and they might find some relief in that regard in any event. So yes, I think there will be some changes and we'll be able to live with them.
Next question comes from Joe with the Seattle Times. Governor, other states are starting to require people to wear masks when they're outside and can't social distance, or when they're in grocery stores. I believe New Jersey and New York have done that. Are you thinking about making that a requirement, especially as the state considers opening back up?
We haven't given any in-depth thought to that. Some of the science about masks we're continuing to look at, about what kind of masks really work and in what conditions. I think as we get to this transition point, we'll have more specific advice about that as we get to the transition point. To me, I'll just tell you, as our public health officials have said, it does make sense to be able to wear a mask, even a cloth mask, if you can't maintain social distancing. Right now, we know enough to suggest to people that that makes sense. If you're in circumstances, particularly obviously inside, where you can't maintain 6 feet. We're able to maintain 6 feet in this room. That's why I'm not wearing a mask right now. So it is a suggestion at the moment. As we get to the transition, there might be some orders, but we haven't seriously contemplated that at the moment.
Essex with Cairo.
Governor, it is barely 3 weeks until your order expires. Is it truly realistic to think that we would have necessary testing and contact tracing in place in time for you to lift the social distancing order on May 4th?
That is unknowable. There is some possibility that those things could happen. If you look at the modeling, it would suggest probably not, given the rate of the curve at the moment. Could something happen to seriously increase the decline we're experiencing? Possibly. I wouldn't eliminate that. Is there a temperature thing that might change that? Possibly. Our testing protocols, we now have identified people that can get into these kind of fire brigades. We're in the final parts of putting that plan together about how that'll be administered. So I think we'll have a good program in that regard. I will tell you the longest pole in the tent, the most difficult thing we face is the testing kit supplies for the testing. And this is a huge frustration for all of us because we have ramped up the ability to do analysis, the ability of the laboratories to analyze the sample. It may be in the range of about 13,000 tests a day, plus or minus. But we're only doing about 4,500 tests. That's high. According to the Assistant Secretary, it's one of the highest ones in the world today, actually. But it's not as much as we would like as we go through this transition, because we will need more testing after the transition than before. That seems counterintuitive, but it is the case because we'll have people coming back to work who are going to want to get tested and potentially isolated if necessary. And the reason is we simply have not had enough test kits, swabs, viral transport medium, the vials. This sounds kind of ridiculous, and it is, but they simply do not exist anywhere in the United States right now. So we have been on a huge buying spree, searching the globe for this material. We've had some good breakthroughs the last 48 hours. We have about 1 million test swabs coming into the state right now, which are just, we're so happy about that. And vials and test medium. We also have, we hope, new FDA guidelines that will allow a different type of swab that can be used, almost like a Q-tips, and that will really help us on this aspect. But that's the biggest challenge right now. I think that will be the biggest hurdle to climb.
Jerry with the Everett Herald.
Governor, 2 questions. First, yesterday you received a letter, your office received a letter from laborers and builders with a whole plan and approach for restarting in phases the construction industry. I wondered if you had seen it, and are you ready to, and do you think you can live with and accept their plan and approach? And secondly, as of this hour, 10 inmates at Monroe Correctional Complex have now tested positive for COVID-19. No one has been released under the plan you submitted to the Supreme Court Monday. Why has that not happened? Why has nothing happened?
Well, we want to make sure we release the right people, and it takes time to get the right people to the door, and also to make sure that they have some preparation and that we give some notice to the extent possible to those who may have been victims of their crimes. And I need to sign that proclamation. I haven't signed it yet, or will shortly. So those are just procedural things that need to be done. We have 17,000 people in the correctional system, and we need to get that through the organizational channels to get it done right. I spoke to the prosecuting attorneys and the sheriffs and police chiefs today about a way to try to give as much notice as we can to those who might be concerned about people coming out of custody. And I think we've got a workable plan on that, because their needs ought to have some respect as well. So we're getting that job done. On the construction side, I haven't seen that letter yet, but I do know that we've made real progress in our talks with the construction industry and the people who work in it to figure out some protocols to be able to get back to full construction. So I think that's gone well. When we can actually do that, I can't tell you when exactly that is. It is when these other things are in place. And that's true for, you know, virtually everyone. This is dictated by the data of when we have driven this infection low enough to justify removing some of our social distancing. And we hope that's going to be as fast as possible. I've talked to any number of construction workers who don't want to go on the job, get infected, and go home and infect their families either. So they're interested in getting this number driven down too. They're interested in having a testing protocol and enough PPE to protect them on the job. So those are things we have to have in place to loosen this restriction. I hope they'll come as soon as possible, and I appreciate everybody in the industry talking about how to do this in a safe way.
With Q13.
Yeah, two questions for you, Governor. One just piggybacks off of the question about offenders. I don't know if you saw that in Florida, there was, under very similar circumstances, a nonviolent drug offender released for the same reasons over COVID-19. And he went and allegedly shot and killed someone. And so I imagine that the family of his alleged victim is going to get a big check from Florida taxpayers. So the first question is, are you concerned about something like that, and have you had discussions about that? And then the second question is just around, you know, there continues to be this conversation, especially as this is prolonged, about civil liberties and where the balance is between obviously protecting lives, but also preserving liberty. Can you talk about where you think that balance is?
Well, in answer to your first question, of course we're concerned. Anyone who walks out of a correctional institution, there's 17,000 people, 94% of them are going to come back to our communities. All of them, like any human being, could be involved in future criminality. There's no question that that risk exists. But we do have a court order that has ordered the governor to produce a plan to act whatever is necessary to provide for the physical health of these inmates. And the only way to do that is to reduce the population in these facilities so that there's more distance to reduce the risk. And we have fashioned, I think, a very reasonable plan. The vast majority, or essentially all of these, are people who would have been released in the next 6 to 8 months anyway, most of them within the next 2 months. Many of them already have plans for security after they leave, if you will, as to where they're going to live and the like. Many of them are quite elderly. So I think we struck the right balance between the concern you raised and the one that the court ordered us to act. It's as good as a job that we could do. The civil liberties question is a serious one, and as a person who's always taken liberties very close to my heart, I do think about these things. Look, the orders that I have put in place are in a bit unimaginable to me, perhaps, when I took this job as governor. And it is something that all of us ought to be reflective on and not do casually. And every time I've made an order, I just want to tell you, it's really difficult to know the intrusion in people's lives that these orders have made. Grandparents who can't see their grandkids, people who can't go to work, people who are worried about making their rent. This is really hard on people. And the fact that one person has this responsibility, and it happens to be the governor, it's a really unfortunate but necessary thing. Right now, that's the best we can do. There's one captain of the ship, and we got to turn that ship away from the iceberg. And it's just not a situation where we have time to have a vote, if you will, for everybody on the ship. And I hope that we can release ourselves from that, and I can be released from this burden as fast as we can. That's why the things we're doing are aiming to do that as quickly as we can, so we can return to a normal way of making decisions in our state.
Next question comes from Emery with the Columbia Basin Herald.
Hi, Governor. The last graph that you pointed to from the Institute for Disease Modeling, you said that it showed that we haven't been accelerating as much as we can, but that we've been starting to plateau. What do we need to see? What do we need to change to start seeing that decline more? Are we just asking Washingtonians to redouble their efforts, or are there particular things?
Yeah, we'll just look at the chart together here. What I was referring to is, as you'll see, we bent this curve down. It was accelerating uphill here, and we bent it down to essentially it's about flat in the last couple of weeks. That's good news that we have bent it down, but the trouble is the model at the moment would suggest it will continue to be flat rather than head down to reduce the number of fatalities we have per day. Obviously, that's what we want to do, and that's what we need to do. So the question is how to achieve that. Well, one thing is to continue on an individual basis what every citizen's doing to continue to be even more rigorous in our social distancing. And we also hope that the first curve that I showed you from the first modeler ends up being more predictive than this particular model. And that's not to pick favorites amongst the modelers. It's just that we're all dealing with probabilities. The nature of the virus, the impact of temperature, how much our social distancing continues or doesn't, all of those things could have an impact on these curves. What I wanted to share with Washingtonians is there's just a lot of good reasons to understand that there's one thing we can control today, and that's what we do in social distancing. And all of these suggest we've just got to be committed to that 110%.
Governor, you still have May 4th as the date. Governors of Oregon and California have already started talking about the phased-in reopening. You don't have your plan out there yet. I understand you agree with much of what they say. But why not, if social distancing is the critical thing that happens here, why not allow a phase-in of construction if they maintain social distancing? Or in hospitals with protection and elective surgeries to get the hospitals going again because they're not the surge. How about, is there a possibility of easing up prior to May 4th?
Yes, there's possibilities plus, minus, or on that date. Sure, there are possibilities. There may be possibilities on elective surgery, but we still do not have enough PPE, personal protective equipment, in our hospitals today. So we have to maintain masks for people doing emergency surgery instead of cosmetic surgery or even hip surgery. I had hip surgery. I understand how wonderful it is. But at the moment, we still have to be jealously guarding that stockpile at the moment. That could change as we continue to evaluate this, and we do it on a daily basis. The same thing with any of these industries, construction or otherwise. If, in fact, we see this curve going down dramatically, if we look like we're heading down to the zero that we're searching for, if those things happen, then yes, we can consider that or other industries as well. But those things need to happen. Usually when you let up on a pedal of a car, you slow down. That's not what happens in this case. If you let off the pedal of social distancing, you go backwards and fatalities increase. We cannot accept that. We are a better state than seeing more people die in our state because we gave up a few weeks early until we got the job done. And that's the reason we're making these decisions. Now in construction, as I've said, we're working with the industry to try to figure out how, as we go through this transition, we can do it in the safest way possible. And I think those talks are going very well, and they're going to continue.
Next question comes from Jim Camden with the Spokesman Review.
Governor, there's a cluster of COVID-19 cases connected to the Tyson plant in Wallula. And I'm wondering, would you consider ordering that facility closed if you have that authority, and under what circumstances would you do it?
I have not considered that. I haven't been briefed on that situation, so I really can't offer you any thoughts about that plant. I'll have to ask somebody to give me a briefing on what that situation is. I believe it is possible under the governor's authority, but it's not something we thought about any specific company or site at the moment.
Next question comes from Drew with King 5.
Governor, the mayor of Los Angeles has apparently said that he does not plan on having any large events, including any sporting events, for the rest of 2020. Do you expect that to be the case here throughout the summer, with football season starting in the fall? Do you see any way that we could return to those sorts of events in 2020? And if not, how do you expect the public to continue to social distance and stay at home if we're talking about months and not weeks?
Well, listen, the public are making a decision, and they are committed to saving lives in the state of Washington, and that's shown by the enormous compliance with this order. And I think it's because people understand that they love their family members and they don't want to lose them. That's what this is about fundamentally. And they've been willing to accept these enormous intrusions in their economic and personal lives because they recognize that, because we're a state that does understand that. And I haven't sensed a lessening of that, frankly. It's been gratifying. And if that continues, we're going to save a lot of people. Now, as far as these looking in the crystal ball, I wish I had a crystal ball to answer when, why, what game, what day, what sport. Can't do that. If I could, I would share that with you. Is it possible that we could be in circumstances to have Major League Baseball games this summer? Yes, I think that's possible. If we do our jobs and bend this curve down, if maybe we catch a little break on the transmission rate, if there's new medical advances that can help us through the difficult breathing problems that people have, yes, those things are possible. So I'm not eliminating those as a possibility at this moment. And I understand why there's a desire to be able to have an answer to these questions. We all probably wake up in the morning and saying, you know, when will be the day? But and so I understand that frustration and that eagerness, but I would hope that what we ought to focus on one date, and that's today, because this is the one day we can control. We can control today, and what we do today can make it faster getting out of these doldrums and faster to get back seeing our grandkids and our grandparents. That's the day that's important. And I think it's April 15th. If it isn't April 15th, it's close to April 15th. And that's the day that we ought to care about right now, because that's the day we can control, and that's what I'm focused on right now.
Next question comes from Paul with Bloomberg.
Hi, Governor. Do you see it as possible within the context of what you just called for, which is continued rigorous social distancing, for major manufacturers such as Boeing to reopen while the physical distancing program is still in place? And if so, what conditions would you want to see such manufacturers meet to keep from sabotaging the progress the state has made with your social distancing orders?
Again, it may be possible, and the protocols are very important. I've had a discussion with Stan about this at Boeing, and I know they're going to be very conscious and intentional trying to develop those protocols, and that's very important. Boeing's close to all of us, and I kind of come from the Boeing family of my uncles and cousins, so making sure they're protected is very important, and we will be committed to that. And we will be committed after we go through this transition. By the way, maybe Keith asked the question about California and Oregon. Look, I in the last few days have shared with my fellow citizens what our transition is going to look at. It is going to include first testing, second better contact tracing, third a wraparound protection of our vulnerable citizens, fourth a way to make sure that our hospital system has surge capacity. We are the only state in the West Coast that sent back a hospital, actually, because we have adequate hospital facilities, and we've closed our schools and are now planning to have intense remote learning. So this is a vision statement we've talked about, and we will have more specific plans to share with you in the forthcoming days.
Couple more questions. Next, we go to Jim Drew with the News Tribune.
Governor, you've said many times that we control our own destiny. I want to see if you have a concern about other states that Washington can't control, that may reopen their or ease their restrictions too early and reopen their economy at the president's direction. And if so, how does Washington deal with that?
Well, yes, and it's not states. We are in an international economy. We're very cosmopolitan. We export and import, one of the biggest export states in the country, obviously. So, we have to be concerned about the virus coming back from any source. And that's why it's so important to have this very comprehensive testing and contact tracing program so we can jump on this from any source, domestic or foreign. And I think that the need for that is equally applicable from viruses coming in from another state, for another country, or from another city in our state. The threat is the same. And that's why we have to have the same rigor and comprehensiveness of this testing and contact tracing program. And so I guess what I'm saying is, yes, it's a worry, but not any greater worry than a source of virus from any other place. I do think it would be helpful if the nation has a more aggressive approach as a nation. I can say that. And we have urged the president to be more aggressive, particularly in the production of PPE and test kits that can help the whole nation. Every governor is struggling with these challenges to one degree and another. And that's why we're hopeful. And by the way, there was a good sign I should share with this, because I've talked with you several times about this need for a national mobilization. Some time ago, I urged the president to engage the Pentagon and the Department of Defense to activate their supply chain. And that wasn't happening for some period of time. But yesterday, the Department of Defense indicated they were going to really activate their supply chain to see if some of the people who make defense products can make some of these medical products, including test kits, including viral transfer media, the whole 9 yards. That's a really good thing, because we have such an enormous, well-developed supply chain that supply our defense needs. If they can now start making some of these other products, that would be fantastic to give us more of these test kits that we desperately need right now.
Next question comes from David with Crosscut.
Yeah, hi, Governor. Thank you. There's some disparities between each county in Washington in funding and infrastructure of their public health departments. I'm wondering, how confident are you in the ability of those counties' health departments outside of here, Snohomish and King, to effectively respond and continue to keep the virus under control?
Yes, this is a really valid concern, because some of our smaller counties have, 1, 2 people to tackle this. And the state is going to need to help all the counties, but particularly those counties. And I've talked to John Weisman about this subject today as we're developing this plan. And it is going to make sure we have, a disproportionate state assets to help those counties that are not well manned. It is a very important point, because the whole state is subject to being attacked by this virus. One of the things we are working through right now is the organizational structure of this effort. The county health departments, as you know, have been historically and by statute responsible for the health of their citizens in their counties. We're trying to figure out the best organizational structure where the state can help that, to get both personnel and assets and expertise to assist that and have the most consistent approach across the state. And we're designing that organizational structure as we speak.
Final question comes from Hannah Scott with Cairo Radio.
Hi, Governor. Just 2 quick ones. One, the inverted mitigation schedule that you mentioned, as far as anything reopening that's possibly being considered, it would have schools opening sooner than businesses. And what would you say to those businesses already struggling now with them on that lower end of the list? And also any scenario where you would order only those at high risk of the virus to stay home and let everyone else go back to work?
Well, we haven't thought through that issue of vulnerable individuals, but we've done a version of that. Yesterday, I put in place a provision to protect our vulnerable workers. And it basically, our citizens who are vulnerable over the age of 65, those with serious compromised physical conditions, we've now given them a protective bubble, if you will, that if they cannot work, and their employer can't give them adequate alternative environments where they feel safe, they're entitled to basically obtain benefits and get their job back at the end of this. So we, in effect, are giving an option to our vulnerable citizens to be protected. It's not an order, it is an offer of an option to embrace them and protect them. I'm glad we did this. I think we're the first state in the country to have actually done this. And obviously the reason this is important is something like 85, 90% of the fatalities have been people in this vulnerable category, or at least over the age of 60. So we really want to protect this group of people. They now have an option to be protective, to weather the financial storm here, and then go back and get their job. I think this is a really good policy. I'm proud that we've done it. The issue of schools versus businesses, I wouldn't take my comment that this would come out as an inverse as for sure saying that schools are going to reopen before any businesses. I was just kind of giving you a general direction, if you will. Schools are going to reopen when they can be reopened safely, and this is again another reason why we have to be so dedicated to a comprehensive testing and contact tracing system, because we can't have a situation that when one child develops a fever and a cough, we have to shut down the whole school in September. We ought to have a better system to deal with that, and that's why we're so committed to getting that job done. No, again, thank you very much. I want to thank those in the media right now. I talked to somebody the other day who realized what a tough job they have during this situation. I just want to thank you because you can't overstate the importance of your jobs right now. Communication is the single most important asset we have, and the fact that you're spreading good information and challenging the government and governor to share information, really important. So please thank your families for letting you work so hard. I appreciate it. And wash your hands. Thanks.